Okay, so now we're going to talk about how to set the patient up onto the V60. Now, before we look at the V60 itself, we need to look at the consumables required. So there's clearly lots and lots of different types of masks out there. Not all faces are the same. We need to have certain masks for certain shapes of the face and sort of how wide or not their mouth may be open at that point. Before we talk about the masks, we're going to go from the machine to the patients. We're going to just very briefly look at the circuits. Now, you can do dry circuits or you can humidify. Again, a common question, can I humidify on the device? Absolutely right. There's a bracket on the stand that can hold a humidifying device, and then you have the circuit like this, which is shown in 3 bits. Okay, so it's quite complicated to look at. Certainly you have one short part which will go onto the machine. Then you have your humidified chamber, which is where you're putting the fluid into. And then, of course, your circuit will come from the chamber to the patient. Now, it's very, very important to use a circuit like this, where the wire is embedded on the outside. That means it can be really nice and smooth on the inside, which allows for that small, tiny trigger that we said in the introduction about that auto track. Only needs a small trigger. Now, with the wire on the outside, it can detect that, no problem. So that's a humidified circuit. But we're going to show you the dry circuit, which is what's used possibly more commonly. All comes together with a filter. So you really, really must have a filter on the end here, because that's going to go onto this exhaust part here where the flow's coming out, and that's going to protect the machine from the patient, patient from the machine, and so on. So in other words, any bugs, infection the patient may have simply can't get into the machine via that filter. So we're going to put this other line, the V60 needs something called this proximal pressure line. That goes onto that little port there. And then we have an optional filter on the exhalation port. The circuits used for the V60 must have the exhalation port on it, not on the mask. Okay, so there's no exhalation port on the mask, it's on the circuit. And then we have this optional filter there that will block whatever microbiology comes back to say what bugs this patient may have, it will get caught in that filter, so protecting the environment, staff, visitors, and so on. So that's the dry circuit. So we're now quickly moving on to how to set up a mask. Now, I'm going to focus on 2, our total sort of face mask, something called the Performax, and another mask which we call the AF531, which is the more commonly oronasal mask. So, starting with the Performax, which covers the full face, and it's very important to measure. There's a measuring gauge on the bag, it simply goes around the top of their face and below the lip, around that size. Never put a mask underneath their chin, because as we'll see with the AF531, if they move their mouth up and down, which they do, it does tend to rub on the bridge of the nose, of course. Now, the Performax is good because it goes over the nose, so you simply can't get any pressure sores. So I'm going to, so I've measured up, and I'm going to place this over my patient's face like this, nicely in position. I'm going to ask my patient to hold his mask at this point. Ideally, it would be better to have 2 clinicians doing this, nurse, physio, whoever. And if you are using 2 people, one person just hold the mask. Try to resist helping with the tying, okay? So one just hold the mask in position, the other one does the tying. So I've put the 2 on the top. Then I'm going to just clip in the 2 at the bottom. Okay, so we're on there, and it's very important to do the 2 at the top first and then the 2 at the bottom. So here we go, 2 top,